Each year, over 3 million Australians journey overseas to a variety of destinations. In doing so, they encounter a wide range of potential health risks. As the public becomes increasingly aware of travel-related diseases and health hazards, many people are likely to visit their GP before they travel. The best time for a pre-travel consultation is at least 4 to 6 weeks before the planned trip, but even a visit on the day before departure can be of benefit. As the patient's first source of medical advice, the general practitioner is well placed to provide information, immunisations and advice about medical supplies to help ensure a safe and successful trip. GPs can also identify situations where referral to a specialist travel medicine clinic is appropriate. A pre-travel consultation involves a risk assessment that takes into account both the type of travel and the health status of the individual. Begin by asking about the planned trip. Is it a business trip, a holiday, visiting relatives, doing aid work? Where is the patient planning to go? Will they be visiting urban, rural or remote areas? What season will it be in each country? What sort of weather are they likely to encounter? How long will they spend in each place? How will they be travelling? By bus, backpacking, driving? What sort of accommodation will they have? Will they be staying in resort-level hotels, hostels, or camping? The next step is assessment of the patient's medical fitness to travel. Ask about the patient's recent health and past medical history. This includes current medications, allergies, and previous reactions, and make sure that a detailed vaccination history is taken. If the patient has a condition that puts him or her at high risk, you may wish to consider referral to a travel medicine clinic. Conditions to watch out for include pregnancy, diabetes, asthma, heart disease, serious allergies, immunosuppression, and chronic illness. Young children and elderly patients should also be seen at a travel medicine clinic. You may also consider referral to a travel medicine clinic for travellers with more complex itineraries, travel to third world destinations, multiple itineraries, long trips, or if you are unsure what advice to give. In some cases, you may need to recommend that the patient does not travel or delays the trip. Airlines are able to refuse travel if certain medical conditions are present, and travel insurance companies may reject claims. Having assessed the patient's health status and the risks associated with their particular destinations, the next step is to discuss and offer the appropriate vaccinations. In cases where official certification of immunisation is needed or you are unsure of requirements, refer the patient to a travel medicine clinic. Special legal requirements apply to some immunisations. If the patient is travelling through a yellow fever area, vaccination is mandatory and has to be certified by an authorised clinic. Some countries require a record of Mantoux testing and TB vaccination. Pilgrims on the Hajj are required to carry a record of both yellow fever and the quadrivalent meningococcal vaccination. It is important to ensure that patients have been offered all the routine immunisations as recommended by the National Health and Medical Research Council. Even if people are going to be visiting westernised countries, they're likely to come in contact with common diseases such as measles, mumps, rubella or influenza. In addition to immunisations, the pre-travel consultation is an opportunity to provide advice on other disease prevention. This can cover preventive food and water hygiene, safe sex practice, parasite exposure risks, prevention of rabies, and traveller's diarrhoea. Malaria risk and prevention should be discussed if relevant. Travel health is not just about infectious disease. Patients may also need to know about avoiding or managing jet lag, motion sickness, altitude sickness, and deep vein thrombosis. You may also wish to discuss personal safety issues, travel insurance, and the need for dental and vision checkups prior to travel. Patients should receive prescriptions for the regular medications and any emergency medications they may need to carry. Advise patients to carry their medications in their hand luggage. You should also provide a written record of vaccinations for the patient to keep. A convenient method of providing patients with a written record of the vaccinations and other advice is to issue them with a copy of the Traveller's Pocket Medical Guide and International Certificate of Vaccination. The advantages of using a document like this is that in addition to being a handheld vaccination record that satisfies WHO regulations, it provides information about immunisations that aids the process of informed consent. It also acts as a record of advice given and encourages patients to return to complete or update their immunisations. Finally, remind the patient to seek medical advice when they return if they have been unwell during the trip or if they have been exposed to a high risk of disease. And then, of course, all that remains is to wish them a safe and enjoyable journey.